10 unexpected cancer symptoms every woman should know. If you were to find a lump in your breast, you'd have it looked at, wouldn't you? Well, odd or unfamiliar symptoms like swelling in your neck, skin sores that won't heal, or unrelenting pain deserve the same sort of vigilance. There's no need to leap to hair-raising conclusions. What if it's cancer? When it could easily be something else. But the sooner you get diagnosed, the quicker you and your doctor can take appropriate action. With all cancers, early diagnosis is key, explains Stephen Rubin, MD, Chief of the Division of Gynecologic Oncology at Fox Chase Cancer Center in Philadelphia, so women ought to feel free to see their physician to have these things checked out. 1. Scaly patches or warty lumps. What is that red, scaly patch of skin? If it's on a sun-exposed area of your body and it's still there 8 weeks later, don't assume it's eczema, Dr. Glashofer cautions. It could be a sign of squamous cell carcinoma. This type of skin cancer sometimes has a warty-looking, or dome-shaped, appearance, he says. It commonly shows up on the head, neck, and back of the hands. Women tend to find it on the front of their legs from years and years of sun exposure, he says. 2. A pearly pimple. Heads up, tanners. The most commonly diagnosed cancer in the US is actually skin cancer, specifically a type called basal cell carcinoma, which is linked to ultraviolet light exposure. Mark Glashofer, MD, a board-certified, private practice dermatologist specializing in skin cancer in northern New Jersey, says basal cell carcinomas sometimes have a pearly translucent or waxy appearance. Other times these cancers look like sores, scaly patches, or cyst-like bumps. A lot of times people come in and say, "Hey, I've got this pimple on my cheek or my nose, it's not going away." Usually, these cancers are slow-growing and highly treatable, Dr. Glashofer says, adding that any bump persisting for 6 to 8 weeks ought to be checked out. 3. Foreign body sensation. An annoying lump in the throat feeling often goes hand in hand with acid reflux. But sometimes that awkward sensation is telling you a tumor is present. It's almost like, okay, did I swallow a chicken bone? Is there a hair back there, says Bruce Davidson, MD, professor, and chairman of otolaryngology head and neck surgery at Georgetown University Medical Center in Washington, D.C. One patient bothered by this symptom saw multiple doctors over 5 years before seeing Dr. Davidson, who found a tiny back of the tongue cancer using a scoping procedure. Dr. Davidson says base of tongue and tonsil tumors are on the rise due to human papillomavirus infections, which are often acquired through oral sex. HPV can lay dormant in the body for years before producing symptoms, he adds, so people may not know they're even at risk of oral head and neck cancer. 4. A hoarse voice. Some people temporarily lose their voice when they catch a bad cold. Hoarseness that persists is a different matter and should be evaluated promptly. Laryngeal cancer attacks tissues in the part of the throat that houses your vocal cords. This type of cancer might also cause throat pain, ear pain, or a lump in the neck or throat. According to the National Cancer Institute (NCI), cancer of the larynx can also spread to the thyroid, trachea, windpipe, or esophagus. 5. Ear pain. What does it mean when one ear constantly aches, but there's no sign of infection? It may not be an ear problem at all. It might be referred otalgia, meaning pain that travels to the ear from nerves in the head or neck. Lots of conditions can trigger this sort of ear discomfort. One of them is oral cancer. Early cancer on the back of the tongue or tonsil might have pretty subtle symptoms, explains Dr. Davidson. Someone can have ear pain without other symptoms for weeks or months before the oral cancer is uncovered, he says. It could also be a sign of later stage mouth cancer that's burrowing down and starting to interfere with those nerves. 6. Anemia. Blood in your stool, if it's not caused by hemorrhoid, is a classic sign of colorectal cancer, the third most commonly diagnosed cancer in the US, but according to the American Cancer Society, ACS, anemia, which can make you feel tired, lightheaded, and dizzy, can sometimes be the first sign of this cancer. The reason? Colorectal cancers can bleed into the digestive tract, the ACS says. While you may not always detect rectal bleeding, it tends to be microscopic bleeding. Dr. Moskovitz explains blood loss over time can lead to low red blood cell counts. 7. A lump in your neck. Not all lumps are cancer. You could have swollen lymph nodes due to a recent infection or a slow-growing cyst in your neck. Likewise, a nodule or swelling in the center of your neck where your thyroid is located is most likely benign but should be checked for cancer. Women are 3 times more likely to develop thyroid cancer than men. The good news, it's usually slow-growing and highly curable. 8. Bone pain. Bone pain may be the result of an injury, infection, or osteoporosis. Or, it can be a sign of cancer. Unexplained bone pain, especially in the spine, pelvis, and ribs, may be a symptom of multiple myeloma. This type of cancer affects plasma cells found in the bone marrow. It's more common in older adults and African Americans. Bone or joint pain in people who have symptoms such as fever, fatigue, or weight loss can be a sign of leukemia, a type of blood and bone marrow cancer. 9. Breast swelling or dimpling. It should go without saying that any unusual breast changes, not just lumps, require immediate attention. Breast pain, redness, and swelling are typical signs of mastitis, a common breast infection, particularly in breastfeeding moms. But did you know that inflammatory breast cancer can cause the same symptoms? Women who develop this aggressive type of cancer may have thickening of the skin of the breast and dimpling, making the breast look like the peel of an orange. 10. Belly bloat. Occasional abdominal pain or bloating is a common complaint not specific to cancer. You might have a GI problem, like irritable bowel syndrome. In rare cases, though, bloating and pelvic discomfort are signs of ovarian cancer. Only 1.3% of women in the US will be diagnosed with ovarian cancer during their lifetime, according to the NCI. However, the ACS says ovarian cancer is the fifth leading cause of cancer deaths in women, not counting non-melanoma skin cancers.